Give me a sound check, please.
Check one, check one, check one, check one, check one, check two, 2, 3.
All right,
How's the
guys.
level there? Hello?
Levels are fine. We are about to start in 30 seconds. I hear some feedback by the way.
Yeah, it's okay. I fixed it.
Did you?
Yes, I did.
Check.
Now you hear feedback?
I hear myself. It's very low. It's fine, though.
Okay.
All right, guys. We will be back. We'll be starting the show in about 20 seconds. Bear with us.
And now something completely different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Coburn's The Bald Truth.
Hey guys, welcome to the broadcast. First of all, I would like to, let me turn on the phone lines. I'd like to let everyone know that today is actually April the 13th. I've been getting people writing me asking, what are we doing on the show of the 12th? And the 12th was yesterday, apparently. Joe.
Yes, it was.
How are you, man? Let me plug in the phones. I forgot to plug those in. Plug in the phone lines.
Well, it's been a while, man. You're forgetting stuff.
We have actually been doing our live town halls for the industry, so I've been pretty busy doing that. But yeah, I mean, setting up the feed to go back to YouTube was a little bit of a pain in the ass just now because I was not able to lock it all in, but we made that happen. And first of all, I want to welcome everybody. We have not been doing the live broadcast for our listeners and our fans and for the consumer, for about 2 weeks. And one thing that I've learned during this pandemic, besides the fact that most people suck, but I knew that anyway, is that this industry will be narrowed more than I even could have imagined. I'm seeing, at least from my end of things, seeing the way that people are behaving and physicians are behaving during this panic really helps me to kind of cut the cord, so to speak, with certain people who I have been, let's just say, kind of looking at with a jaundiced eye for a while. Is that a bad thing to say?
Developments I'm not aware of?
No, you're aware of every development. Nothing new.
I thought there might be something new, yeah. We haven't talked in a couple of days, so.
Yeah. No, nothing new. Except
things move at things move at the speed of hair transplant surgery, baby.
Jesus,
it's always moving. It's always changing.
The fact that I don't know how I'm doing it, but I'm still maintaining a decent haircut. It's fucked up. It's hard to cut it myself, but it's something that I've been really working at. So I can see that there's some music
business in front, party in the back. That's
it.
what matters.
Yeah, absolutely.
All right.
I know that there are a lot
the
of
music. Sorry, is next to our studio. My wife teaching piano, so COVID-19, baby.
Listen,
that's the way things roll.
I'm watching the mainstream media, and I'm seeing these people who are obviously totally unprepared for this, like most humans are. But what I'm seeing being casted, produced from people's homes, you would think, hey, listen, maybe a tech guy could at the very least provide these people with some basic information on equipment that they need to use in order to make their feed look as professional as possible during these times.
It's not even about professional. It's about having it look presentable.
Presentable,
there's a difference. It doesn't have to be professional. It can be just presentable where, the subject looks like they're made up of more than 3 pixels.
Right.
You at least want that much.
If I was, my sound, you can hear me well, right? If I was, if I was MSNBC or CNN or Fox News, I would essentially get everyone together, talk to our tech people. If you don't have the right people, find somebody, figure out what each broadcaster, type of internet they have, type of equipment they're currently using, and then send them everything that they need in order to have some sort of continuity across the board.
Yeah.
Cheap, easy, and as long as you have 10 megabits upload, there is no fucking reason that the feed should be coming in the way that they are.
100%.
So anyway, guys, phone number 888-659-3727. This is the Hair Loss Show. Joe Tillman put out a video this week that has had a tremendous amount of activity, and a lot of people have been interested in this subject for a long time. I am obviously very familiar with it, and I've made my assessment both behind the scenes and to some degree with you guys as well. But Joe has been a little bit more, let's just say, candid about the reality of this poor guy's journey, hair transplant journey. So, Joe, I'm going to let you take it away.
Right on, yeah. So, for those of you that aren't aware, I put out a video back in, I think it was August or September. I think it's maybe September of 2019. Because I'd seen a really popular video by this group called the Try Guys. It's these four guys and their friends are all involved in these things where they try different things online for the what's the phrase I'm looking for the draw, I guess. It's just fun to watch these guys do things that are kind of silly, experimenting on themselves, stuff like that. But one of them had been talking about his hair loss, and which I thought was really brave of him to begin with. I mean, very few people, especially that are already in the public eye, like these guys got like 7 million subscribers or 8 million, something like that. It's crazy. Very few people will openly discuss not just their hair loss, but how it affects them. So I really this kid, Zach. And then it turned out to be one of these what's turning out to be a typical documentary style video on YouTube where someone that's got a huge channel goes into a clinic and they document the procedure, and of course it's kind of glossed over as far as the technical details because most people wouldn't even get it, and that's fine. But I was watching the video that they produced, and I was concerned enough about what I saw to where I thought it would be necessary to critique it. And so I put out this video where I'm critiquing some of the things that were said and some of the approaches that were taken with Zach's case. and it got real popular. Like it's almost 100,000 views, and so everyone's been asking me, well, what's been going on with him? And some people have been contacting me saying, yeah, that I've been following his Instagram, and it doesn't look good. And I didn't want to just come out with a video to, go directly towards his experience and his current result as we're seeing it today. I want it to be more, I guess, more comprehensive than that. I want there to be a lesson to be learned. And so I combine that with another question that I've been getting for years. I've been getting this for 15 years now. What is the best FUE method? And it hit me. It's like that. This is the perfect opportunity to evaluate Zach's results at 9 months and use that as a segue into the lesson of what is the best tool. So I'll release that this past Thursday at 10 a.m. and it's over 12,000 views now. It's doing well. And a lot of interesting comments on it. I got to say, some people are giving me a hard time for critiquing it. Like, what do I know? I'm not a doctor. Most have been supportive, though, saying, yeah, it looks like it's not such a great result. And it's not, unfortunately. At 9 months, there is very little change. Like, you have to look hard to see the change. And that's not what you want in a hair transplant. So I think it's interesting. And I'm waiting for the first person. No one said this yet. You got to give it the full year and a half, because when that comment comes out, I'm just going to shoot that one down too. Because if by 9 months, you should at least have something that is a representation of the future. And unfortunately, we're not. Like, if what we're seeing is an indication of the future, then it's not looking good.
I didn't hear a word you said. I'm typing. I'm just kidding. I heard some of it.
That's what we heard.
Yeah, I just heard some of it. But I heard during this conversation, I saw in the chat during this conversation that Dr. Deep is open for business, doing consultations. I think it's important for any physician who's listening to this right now to understand that at least here in the United States, your malpractice insurance carrier will not be covering anything related to COVID at this point if you remain open against state policy. Or, God forbid, if someone is disfigured and then gets COVID. I mean, I can't even imagine how anyone would potentially want to put their staff at risk, potential patients at risk. It's one thing once this is lifted and to ensure that there is specific safety protocol, testing in place, surfaces covered in place. Everyone has to be suited up properly, both the patients and the physicians. There are going to be guidelines that are going to be put out by both state and federal guidelines put out in this particular field. We have been contacted by both federal and state agencies to provide that information, and I'm working with a few people and I'm going to be getting some more guys together to ensure that consumers know what the fuck they're walking into. But as of now, in the state of California, if you're having a consult in a hair transplant clinic, we're not talking about eye surgery. We're not talking about something that's emergent that needs to be done. All I can tell you is that's just fucking bad. That's just really fucking bad, and that upsets me.
There's a certain ethic that's required to make the decision to stay open or to close, and most people are closed. I wasn't aware that anyone in California would be open right now. I'm shocked by that. I really am.
Well, I'm also shocked by the stupidity.
Physically doors open.
I'm also shocked by forget about the fact that you're putting lives in danger. Forget about the fact that your staff is being put in danger and you're being put in danger. You can be shut down and locked down for a long time if people get sick. But let's just talk. Let's take the ethics out of the equation from a pure survival licensure point of view. It's possible that you can lose your license It's also possible, it's very possible, and at least from the malpractice carriers that I have been in touch with, that you will not be covered during this time if you were to be dumb enough to keep your doors open. So
100%.
the physician will be personally liable for everything. That will put him out of business completely, and he may, at the very least, have his license suspended. I don't know who this guy's attorney is or who his advisors are, but Jesus Christ! All right, I gotta check that box next time he applies to the organization, which has been twice.
Really? Oh,
yes.
Oh, that's right. Yeah, I remember you told me once.
Anyway, so let's get back to Zach. Sorry, man. I'm sorry, guys. Just please listen. During the month of April, don't have any hair transplant consultations that are not virtual. You can get a really good assessment virtually these days, especially if the doctor provides you with the right home equipment that you would need for them to make a reasonably accurate assessment. Now, remember, for the larger clinics, about 50% of their consultations are done virtually anyway. And now they are going to be performing even more in-depth virtual consultations. So do not put yourself in danger. And if someone says that they're open right now, this month, here in the United States of America, take them off your list. They should not be on your short list, in my opinion. It has nothing to do personally with this particular doctor. It has nothing to do with the quality of his work. But in my view, as a human being, it's fucking bad news, man.
It's disturbing. It really is.
Now, we have some phone calls. Do you want to just get to the calls?
Sure. I need to keep them waiting.
Hey, you're on the air. Who's this and where are you calling from?
Hey, it's Trevor from New Jersey.
Trevor, how are you, man?
Hello, Trevor.
I'm doing all right. I'm healthy.
I'm glad.
Everything's fine. I'm not really in the high-risk category, so I'm not really scared for myself, at least.
Well, I just want to, I want to, since you brought that up, I want you to know that the quote-unquote high-risk category, those goalposts are moving consistently. I've known some young guys. I know one young guy right now who's in the hospital. He's like 24, 25 years old. Absolutely not in the high-risk category. So it really doesn't, not to my knowledge, but it really depends on, there are some people. There's something called a cytokine storm. Some people who have actually really, go ahead, Joe. Cytokine storm. People who have really healthy immune systems, for whatever reason, their immune system will attack this in a way that could actually shut down their other organs. So now they're finding out that really nobody is safe. But, so I just don't want you to have any false sense of security.
Thanks for calling.
Have a great day.
Sorry, I was just kind of absorbing in what you had said there.
Yeah. No, it's okay.
Yeah, okay.
I don't mean to bum you out, but
that.
I just want you to just be aware of this.
So tell us about your hair problems.
I appreciate you. I appreciate you looking out for us like that.
Sure.
Yeah, I didn't know about that. So I'll Google that after this call. So my question is for Joe, and hope you guys don't mind. His question is not necessarily related to the video that you put out or related to COVID.
We do mind.
And so,
right.
No, go ahead.
Okay.
I'm just kidding.
So basically, I would like to give you all of my details, all of my information regarding me and having a future procedure. Will be my first one, and ask you the question afterwards. What are the benefits of waiting longer? Because I've always heard that you want to wait as long as you possibly can. It's better to have it later rather than sooner. And so here's all my information about this.
Okay, so before you go into that, what we'll need to know is your age, Are you taking medication like finasteride or minoxidil? How long have you been losing your hair? What's your hair loss pattern? Have you consulted with a doctor? And how long have you been doing your research?
I've been doing, all of that's about to be said.
Okay.
So I've been doing my research for about 5 years, been fighting, I've noticed it about 5 years ago, but the rate of progression has not been insanely fast. I've done all the research. I've watched all your videos from many other sources, read a lot of articles. I'm 100% sure that I'm going to have a procedure at some point. It's all a question of how long I'm going to wait. I'm 27 years old. I'm between a Norwood 2 to 3 right now, basically like a Norwood 2 with just a really thin hairline, and been on finasteride for 10 months, no side effects. I saw Dr. Doran in Manhattan. I had a consultation there with Dr. Doran and Peter, the assistant there, a few months ago, about in February, before this whole thing got really bad. He said, I absolutely am a candidate. He estimates that I have about 8,000 in my donor region. He recommended a 1,300 graft FUE, and I'm on board with it. It would not make a huge difference, but you know, and he told me that I would have to have multiple procedures to get the density that I want. He said he'd be lying to me if he told me otherwise. And I think that answers everything that you had mentioned a second ago. And yeah, the reason why I don't want to wait any longer is because I'm in my prime right now. I want to enjoy life now. It really does bother me very much, and I think it would make a huge difference to have my hairline thickened up a little bit, lowered a little bit. And so the question is,
so you know, Joe's actually frozen, or he's playing like he's frozen. I don't know.
No, I'm frozen. Can you hear me?
Yeah.
Okay. Yeah, it's frozen.
Yes.
Yeah. It'll catch up here in a sec.
Yeah. So maybe you can answer the guy's question.
Well, I missed the last part of that. So, so he told you that you're going to have multiple procedures in order to achieve density. He said, I'd be lying if I told you otherwise. And then after that, I got lost because I was focusing on my image being frozen. So what was the wrap up on that?
It is a nice pose you got going on there.
Thank you.
So the last part was, it's like, you know, I've always heard with hair transplants, you want to wait as long as you can. Like, it's better to have it later rather than sooner. But the thing is, I'm in my prime right now. You know, I've been on medication. He said, yes, I am a candidate, and I would really like to have this done.
Who said that you were a candidate, by the way?
Dr. Doran.
Okay, and how old are you?
He's approved. What?
How old are you again?
27.
Okay.
So I'd probably be 28 when the clinics open back up and have the procedure.
That's a reasonable, as far as your age. That's a reasonable age. I would normally, you know, I prefer guys to have it done who are like at least in their 30s for a lot of reasons. You know, I mean, you have just kind of become psychologically an adult. I don't know what your life is like, but as far as, you know, as being a man, we kind of mature a little later in life. And also, you know, our brains really aren't completely mature till about, you know, 23, 24, 25 years old. So I think you're in a position where you can probably make a reasonable decision, but you're still young. And I'm going to let Joe answer this question as soon as he unfreezes. But I get your point about being in your prime. Now, just so you know, I'm 54, and I still think I'm in my prime. So we still kind of feel that way throughout our entire hair loss journey. But it makes sense to me that you want to do something about your hair loss now because it's affecting your life. And did you get into how it's affecting your life right now?
Yes. There are days when it'll hit me pretty hard. Sometimes if I'm look in the mirror and it's like my bangs are down, it's covered up, then it's fine. I just walk out of the bathroom and I can go back to work and whatever. But if I look at my like super thin hairline, sometimes it devastates me to the point where I'll just lay in bed for hours being unproductive. And also like it hits my confidence really bad. and like I want to, go out. Well, nobody's going to be going out for a long time, but also it's going to be, the dating market is going to shift to online, is what I'm hearing. Like predominantly online dating. It's really going to take over here in the next few months, or like maybe even a whole year or more. And so for that, it's like you got to look really good in those pictures, Yeah,
but you could dummy up those. I mean, if it's just about online dating and about not actually meeting people,
it's not.
What?
It's not just about that. No, I want to have this done very badly, and I just want to know, why do they say you should wait? Like, why can't I go ahead and have it now?
Okay, go ahead, Joe.
So, all right, and sorry about my image. It's I'm not sure what's going on with the connection, but so I think, well, the reason why people are always saying to wait is because.
I'm put your image up.
What's that?
I'm putting your image up.
Thank you. Once you're cut, and you can't go back, and you have to ask yourself. How you're telling Spencer how it affects you, but can you continue like this, or is it something that is such a big deal that you can't get past it? If you can't get past it, I think that it's fair to say that you can move it, but I would highly encourage you to get at least, I don't know, 5, 6, 7 more consultations to make sure that the approach that you're already presented with is one that you're comfortable with. Nothing against Dr. Dorn. I like Dr. Dorn. I think he's a good doctor, and I like that he was honest with you about what he feels is necessary for multiple procedures to get to the density that he feels you may be seeking, and that's the case with most doctors. So I applaud him for that, but. Always delay the surgery as much as you can. Do everything in your power outside of surgery to hang on to your hair or to reverse your loss to some degree. Because if you can bring it back just a little bit, you might be happy with that, and you might be able to do that without having your skin cut. If you can't cope with what you're going through, then don't pull the trigger yet. Just continue with the research and the consultation, so you can get a better comprehensive overview of what you're dealing with.
Look, I'm very candid about this and about my thoughts on this, and every doctor that works with us, and including Dr. Doran, understands, even during this very difficult time, that I am going to preach surgery being a last resort for many, many reasons. You have to be completely equipped with the possible reality that everything's going to go wrong. You can go to the best doctor who has the best staff, you can be the best candidate, and you can get fucked up. Would you be able to deal with that?
That's a vague term, though. I'd have to delve deeper into what exactly that means.
Well, okay, let's get into specifics.
Like Zach,
yeah, go ahead.
If I just wind up like Zach, meaning it just kind of looks the same as it did before. Maybe he's got some scarring on the sides of his head. Then yeah, I'd look back and say, hey, it didn't work, but it's not the end of the world.
Well, that's what you say, looking at it from the outside. But if you had to, if you no longer had the option to shave your head, if that was taken away, every time you paid your bills every month, you're still paying for that surgery, and the surgery obviously failed, you would have to deal with that psychologically. You would still be unhappy. You would have lost a year of your life to the roller coaster of first dealing with the surgery, the basic recovery, and then the waiting time. So there's a lot to factor into. It's not just poof, I'm Zach, and things didn't work out. It's a lot that you have to factor into the equation. So you have to be prepared for all that. If you are prepared for all of that, then, and you're willing to take that risk, and if the doctor that you've seen, Dr. Dorn, believes that you are a good candidate and you want to get this done and you believe you're a good candidate, then, that's a choice that you have to make for yourself. And it makes sense. I just want everyone to be completely aware of the entire scope and possible pitfalls of this surgery. And the reason we tell younger people to wait is because they usually have more unrealistic expectations. They want to get closer to what they remember just a few years ago, what their hairline used to look like, as opposed to if you're 50 or 60 and you've been balding for a long time, just having a smattering of hair, enough hair to comb or have a hairline to frame your face can be a life-changing event for these guys.
100%.
So do you know where I'm coming from?
Yes, I do, and it would be nice if there was somewhere like a comprehensive list of all the negative things. I asked Dr. Doran about that in person, and he had mentioned like the risk of infection, but he said no, everybody, it's been extremely rare, and everybody who's had it has always recovered from it.
There is a comprehensive list. You can go to WebMD, and you can look up what to look for in a hair transplant surgeon, and there'll be some information there, including credentials. It does give a list of potential side effects or issues with hair transplant surgery. I think Joe has a pretty comprehensive list, right, Joe?
Yeah.
Yeah.
Certainly do.
On Hair Transplant Mentor. So they do exist, and obviously you can get everything you need from this broadcast. Just ask. What do you want to know? You want to know every possible side effect from a hair transplant or the downsides?
Yeah, because, I mean, especially in terms of my question, like having it earlier rather than waiting longer, because I have been waiting for 5 years.
Are you on finasteride right now?
I've been on it for 10 months.
Okay, how are you doing on it?
So, no side effects.
That's good.
But I won't. It definitely has not thickened up my hairline. I've heard from a lot of sources that other people who said it also hasn't thickened up theirs, and it regrows. I know in some, but it didn't regrow any in mine. I saw one video of a guy who said that there was somebody who was trying to become a male to female transgender, and even they could not regrow the hair with medication. Even they needed surgery to have like a lower hairline, and they're using every anti-androgen like accessible. So if they can't regrow anything, then I imagine it's going to be difficult without the surgery to actually regrow anything.
Well, I can say that. I'm sorry, Joe's trying to get back on the air. He's sending me back my feed for some reason. I don't know why that's happening. But as far as, your basic question, why is being young a potential risk factor? You're currently taking finasteride, and I think that's great because you have a much better chance of maintaining what you have. So if you're going to have surgery at a younger age, it's really important to try your best to maintain your native hair. It's also possible you're going to see the reversal of your... Yeah, Joe, disconnect. It's also possible to see a significant reversal of your miniaturization that could not be that noticeable until 12 months or longer. I've known guys who have gone 2 years and they thought nothing was happening. Then they really took a close look and they're like, wait a second, this is growing back some hair. They don't realize that the overall density has gotten better. So that's a possibility. So I'm glad that you're on finasteride and you don't have adverse side effects. But the real risk for younger patients, people who are in their 20s and 30s, is the fact of the unknown. We don't know how far you're going to progress. And just because you're being told, and these doctors are being honest, that you're going to need multiple procedures, it doesn't mean that you're not going to run out of donor and that at some point you're not going to look like a guy with thinning hair who's gone through 4 transplants. And when you're 40, you're not going to be happy with your appearance, and you're going to want to wish you had the opportunity to shave your head, which is always a possibility. So if you are able to put all of that into perspective and say, okay, I'm 27 now. I'm okay if I can feel better about my appearance for the next 5 years. And I know that this is a risk because I am so young. If you're completely fine with all of that, and the doctor says that you're a good candidate, and this is a doctor who does who really knows his stuff, then I would say you're taking a balanced look. You know the entire scope and the possible pitfalls, and you recognize that this may not be a lifelong positive experience. That make sense?
Yeah. You're saying that if I can accept all of that and I can live with the potential downsides and the potential negative things that could happen, that it's okay to go forward with the surgery, basically.
I can't say that it's okay. I could say that it's at least, you have to be okay with that. If you're okay with that, then it makes sense. If you're fully informed, then it makes sense. If you really want to have this done, you're going in as an informed patient. That's all I'm saying. I can't say whether it's okay to have a hair transplant or not to have a hair transplant, but if you have been viewed as a good candidate by a surgeon with the right credentials, which you have been, and you really want this done, as long as you're aware of all the possible pitfalls, then, you're not going to come away from this if something goes wrong in complete shock and, severely depressed because you weren't aware of this. Now, on the flip side, it could change your life in a way that, that you've wanted. It could be an extremely positive experience. You could end up having a great-looking head of hair for decades. I don't know how to be more honest than that.
Go back and look at first hair transplant class number 1. Don't have a hair transplant. That's the whole message I'm throwing out there.
Yeah.
If you haven't prepared yourself for the possible, the very real possibility that you won't be happy due to whatever number of reasons, then don't have a hair transplant. Keep researching until you've understood, like you've grasped, you feel like you've grasped the concept that it's not a guaranteed outcome.
I don't think anyone who watched Zach's original videos understood the reality of what he was going through because it wasn't presented.
I don't think he did.
No, he did not. It wasn't presented, in my view, at least publicly. I don't know what was presented behind the scenes, but at least on video, this was presented as a nothing procedure that they didn't even consider, at least this particular clinic, and at least according to what was said on the video, that they don't even like saying is surgery.
Yeah, they're like calling it a procedure.
Yeah, but it is surgery.
Or a treatment.
It is actually, it's a form of organ transplantation. Mm-hmm. And it's very real. Except you're transplanting, you're your own donor. So it is a very nuanced, difficult procedure to pull off well. And it is probably one of the most difficult forms of cosmetic surgery that exists today. So to make it appear that it's just a commodity and it's not really surgery and this, and that we have this magic machine that makes it all happen, that's not fair to potential patients.
That's given a pet name. The robot was given a pet name.
So listen, man, I hope that gave you some. We're going to take some more calls, but I hope that gave you some basic solace, and you kind of understand. I don't want you to be depressed about this call. I want you to just be prepared. That's what we want to do. Listen, Dr. Doran has done a lot of great work. Dr. Doran has been a part of what we do for a long time. Dr. True was a founding member of the IHRS. These guys both have incredible, long-standing reputations in this field. But like with any other doctor who performs surgery, they have unhappy patients out there, at least one. So if you are prepared to know that this is a possibility, then, it looks like you're doing your research. That's all I can say. And you found a good doctor.
And there's good questions that you've been asking, but my gut tells me you need to keep asking more questions. You definitely need to look in. Dr. Dorn's one of the good guys, as far as, from what I know on the outside looking in.
He's a very good guy, actually. I happen to on a personal level, I happen to like him.
Yeah, I've met him in person. He's very personable. I do enjoy talking to him, but this is for your own benefit to understand to have more of a comprehensive understanding of what he's presented to you by listening to what other doctors would present to you.
All right, man. Well, listen, you got some time to wait. You got some time to think and research anyway, because everything's fucking locked down, except for apparently one guy out here in California, in Southern California, which is unbelievable to me.
Yeah.
Yeah. Last question. When you said more consultations, did you mean with the same or different clinics?
Different. Absolutely. 100%.
I mean, it's okay if you're attached to Dr. Jordan, you want him to ultimately do your surgery, but it's also important to get other assessments from other professionals.
Yeah, that's what we're talking about.
Got it. Okay. Yeah.
And you know what the great news is? Nobody's doing anything. Everybody's waiting for an online consultation. Now's the perfect time.
Oh. Okay. I was thinking I had to wait till all this bull crap was over to have another consultation.
No. Everybody.
Are you kidding me?
Now is the time to do it.
These doctors that were never doing online consultations are sitting by their computer all day long waiting for the emails to come through that they've set up that are specifically for online consultations.
We are having to explain to physicians who are contacting us through our town hall how to actually do an online consultation, what software or what platforms they should be using, the fact that they should be supplying or at least asking their patients to get a digital microscope that they could attach to their phone or to their iPad or to their computer so that they can get a better assessment of their miniaturization and also if there's any dermatological issues happening, so that you can actually have a good, thorough consultation. So yeah, now is the time, man. You could have a consultation with 20 guys and get different prices, different assessments, and kind of figure out if what Dr. Jordan is telling you is something that you're 100% comfortable with.
Sounds great. Thanks, guys.
All right, man. Good luck.
Thanks for calling.
Thanks for calling. Stay safe. 888-659-3727. For a second, I'm like, is this guy listening? Is he on the line? What's going on?
I was wondering if the signal was going through as smoke signals.
But I'm glad he called. I mean, I think those are important questions, and I want everyone to know that, listen, while things are shut down, except for Dr. Deep's office. Sorry, I shouldn't get upset. While things are shut down, this is a perfect time to really do your due diligence and contact as many surgeons as possible to get an assessment of your situation. And this way you can kind of compare and contrast all the information that's being presented to you. Phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
It's Morty calling from Coronavirus Brooklyn.
Morty, man, how are you doing in the epicenter of this worldwide pandemic?
Well, you know what? I couldn't tell you because I've been stuck in my damn house all this time.
Good man.
It's been kind of crazy, man. I can tell you, it's affecting a lot of people. I don't know if I told you this on my last call. I knew a young gal, shy of 40, died 3 days of infection. She was a former work colleague of mine.
No, you did not tell me that.
She was a smoker.
Sorry to hear that.
She was a smoker. Yeah.
But you know what? That's interesting. Everyone is kind of deferring to who are the more susceptible to this, and they're talking about what the government is saying. Smokers, people with pre-existing conditions, all that stuff. For any healthy human being that this affects, not just that, there are people who are going to have this, not even know they have it. But for the 20% that do know they have it, whether they smoke or not, they are, in my view, just from the information I have, possibly as susceptible as people who have lung conditions and who are smokers to having the same type of lung issues. It also, what's not really talked about by the media is how this affects a person's heart as well. Sometimes the virus actually attacks the heart.
It definitely there's information about both of those things.
Yeah.
And yeah, I mean, like I said, I've heard that's a person that I knew directly. I know of people who second degree. My doorman's friend's husband passed away, and that was one of those cases where the guy got sick and he wasn't quote unquote sick enough to get admitted. Because he only had low grade fever, and they basically said just stay where you are until and within a few hours that the person went from having a mild fever to having an insanely high fever, and difficulty breathing. Was forced to take that person to a hospital by themselves because you couldn't go to the hospital with you couldn't
right.
go to the hospital with and then basically to have the person die in the hospital a couple of hours later. That's
fucking frightening, man. And we're talking about there's all these pundits and all this politics, and you see what I see happening through the mainstream media, whether it is conservative media or it is liberal media. The basic argument about the treatments, and this is what I find funny, guys, and you can tell me if I'm wrong. I don't know what your politics are, but the world and the media doesn't seem to understand what prescribing medication off-label actually means. Right. The fact that there cannot be any approved medication for COVID-19 because this just started. Doesn't exist. So to go out there and push this narrative that whether it's President Trump or whomever is pushing a dangerous drug like hydrochloroquine on patients that could actually have life-threatening complications and adverse side effects is complete fucking insanity to me. If anyone were to take a list, if this media, if these reporters, and I use that term loosely because they should all fucking be fired after this, were to take a list of aspirin and hydrochloroquine and see what the potential side effects would be, they would understand that aspirin would not be approved by the FDA for anything with today's standards.
Exactly.
The use of birth control pill, orthotricyclines, have been in use off-label for everything from trying to control someone's period to a woman dealing with androgenetic alopecia. But if you were to tell the media that orthotricycline has a black label warning on it, they would be like, how is this prescribed to people? Especially off-label. People are dying because of politics right now.
Quite literally, yeah.
Literally, because I know... Go ahead, Joe.
I was going to say, another classic example of how medications are prescribed off-label. Most of you listening to this or watching this right now are taking the exact same type of medication off-label, finasteride. Finasteride is not approved for hair loss. It's for prostate health. And you're all getting it off-label. Nothing about the literature in your finasteride box says anything about hair loss. So keep that in mind. It's like there are so many medications that are prescribed off-label. It's ridiculous. So this whole just like what Spencer was saying, the moment that the narrative started to turn towards how it's such a demonizing approach of prescribing something off-label that we don't know very much about. Hydrochloroquine's been around for 65 years. It's not something new. So it's something that's driving me nuts when I watch this, just like what Spencer's saying.
This disease is so new that it's the protocols that are being used are changing literally day by day. I mean, I was just talking to a friend of mine who's a doctor, and they are changing from instead of putting people on ventilators when there is difficulty breathing to just putting them on low pressure pure oxygen, because they're finding that the ventilators can actually exacerbate the condition. And that's something that they've only started doing maybe a week and a half to 2 weeks ago, maybe less. The chloroquine thing was talked about early, and it's become this political football, and it's just disgusting because now people are feeling, oh, if I, and this has been true, I've heard it from a number of different doctors, oh, if a patient asks for hydroxychloroquine, are they just being influenced by what the president said? Regardless of whether the drug will or won't help them.
Well, here's the truth. It acts as an immune suppressant drug, and at the very least, it will help to prevent the cytokine storm that we were talking about. Just that alone.
Oh, yeah.
Not even mixed with, say, the Z-Pak or doxycycline or another antibiotic. So at the very least, this drug can potentially keep people off of ventilators.
Yeah.
It's cheap,
and that's the other thing.
And it's safe.
Yeah.
Go ahead.
And the other thing about it is that the people are behind the curve in terms of the news because it keeps on changing. Like at one point there was all of this demand from New York to get more beds, to get ventilators, to get PPE. Now they're basically saying they have what they need, and there's this question of, oh, well, we didn't get them enough, or when did we not get them enough, and there's a lot of money quarterbacking that's going on, and there's a lot of gotcha politics going on, and it's like, guys, we need to let this go. Yes, we know that in November there's going to be an election, but that's really not what this should be about right now.
Well, I think all of those narratives, every narrative that's out there through the media, needs to just stop. And what we have to do is press the go button now and start from where we are right now. These are the facts. This is what we're dealing with. Now it's time to move on, save lives, and restart this economy when the time is right.
Yeah,
that's it. Everyone can blame. Listen, we can go back and blame Fauci for saying, just a few weeks ago, a month ago, saying that it doesn't seem like it's a real risk. Now, I know it's based on the data that has been provided, that was provided back then. But then from the other side of his mouth, he's saying that he was warning the administration about the very real risk of this happening in January. Yeah. So then why would he come out publicly and say it's not a real risk? What kind of pressure is he getting to do that?
You know what it is at the end of the day? It's what people don't understand is the speed at which this thing is moving. I mean, they did studies where they basically had a person enter space with somebody who wasn't infected, and they found out that within 4 hours of being exposed to the COVID-19 virus, 4 hours, those people were infected and they were contagious.
Right.
So basically, you can go through 3 rounds of transfer in one day. I mean, just think about that for a second. And if you know about the multiplier, that means that in one day, a single person could create, 64 different infections. And they saw that in Korea. There was this one woman who she was a member of a fundamentalist Christian church in South Korea who would routinely travel to China to support an underground church there. And she came back from China. Again, stop me if you know the story, but she came back to South Korea and proceeded to attend every single service. I think it was like 4 services per day in the church that she was at until she became ill. And, so in that period of time, she managed to infect 80 people. This is one person. That's how infectious this stuff is, and that's how rapidly this stuff moves. So while you can say, they didn't act fast enough, when you say acting fast enough, it's a difference of days or even hours. And in some respects, I don't think that's even a fair statement to make. You're going to ask somebody to make policy to shut down an entire economy and blame them because they took an extra 48 hours or an extra week to do something. I don't think that's fair. Now, the truth is that a difference like that makes all the difference in the world. If you look at the difference between Germany and Italy, Germany had an extra week before their first case showed up, and it made all the difference in the world in terms of their response. So that's what you're dealing with. A lot of it's just, quite frankly, it's just luck of the draw. And yeah, I mean, I just wanted to mention another friend of mine had come back from their musician. They were doing a tour of England and when it hit, and they came back, and a week after they got back, they took ill. And so, that's the kind of situation that we're dealing with. A lot of the stuff came in from Europe, and that's the whole thing. It's like,
look,
people
Morty,
are flying back, they felt fine.
I just got to tell you, Joe wants to get back to hair, and so does everybody else.
All right. Well, I will. Okay, I want to go back to hair myself, and I wanted to give a shout out to two doctors. One of them is Dr. Carlos Wesley, and the other one is Dr. Jeffrey Epstein, because both of them have taken the time to do something very similar. They've both recorded, Dr. Epstein recorded a series of Zoom shared lectures about the various procedures that he performs and, answered public questions. I attended one. I thought it was really good. And the other one is Dr. Carlos Wesley, and he has actually put out some new YouTube videos talking about what he does. And, to me, those are really good things that the doctors who are members of the IAHRS are doing in order to inform patients in this time where they can't actually perform procedures, is to go out there and just put out new media and put out information so that people like me can hear what they're about and know what they're offering and, can get to know them better. So just wanted to mention that.
Well, no, and I think it's important timing for everyone to get themselves out there and stop just panicking about what's happening and worrying about what they can't do and focus on the offensive and what they can do and what they can change and how they can reach out in the ways in which Dr. Epstein and Dr. Wesley are reaching out. Because in the end, that pays dividends for everybody. It pays dividends to you, 100%. Morty, every patient out there, and to the health of their practice once doors are able to be opened again. So. Mm-hmm. All right, man. Well, listen, I'm glad that you're healthy.
I'm reading the comments. I'm going to drop off. Yes, I'm very healthy and I'm very happy, and I can't wait till this is over because I want to get back on my hair journey myself. So thanks, guys, for being there.
All right, man. You take care, all right? Stay healthy.
Thanks for calling.
Bye. Mm-hmm. Guys, the phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hi, this is Sean from Toronto, Canada.
Hey, John. How are you, man?
Hey, John. John or Sean?
Sean.
Hey, Sean. How are you?
Good. Just hanging in there. What about you?
You know what? We're all right. Can't complain, I guess. During a world pandemic, I guess things could be worse for us.
Yeah. So I'm kind of like the first caller. Like, my question isn't about Zach's journey. I had my own personal journey, and I just wanted to ask for your guys' input.
Sure.
Okay.
So I'm currently 22 right now, and I started losing my hair when I was 17. Like, it's been a very slow burn. Like, no one in my family has hair loss, so I was kind of confused on how to handle, like, the whole situation.
Well, you're 22. What have you done so far? Like, you've obviously done some research because you found the show and you've called us, but like, what other research have you done? What other measures have you taken? Have you been to a doctor? Like, tell us what you've done about this so far.
Yeah, so when it started when I was 17, I did all the tests, like blood tests, all the tests to see if all my hormones and everything were okay. So then the doctor put me on minoxidil, which I took for a little while. So at the time, I didn't know, like, you had to stay on it to, like, keep your progression, such and such. So I just went off it because my parents would be like, oh, it's not in your DNA, so it shouldn't, like, get any worse. And during that year, I did, like, a crash diet. So I thought maybe it would be like telogen effluvium. I would recover from it. Mm-hmm. But still kind of feel like it's progressing.
What? How long did you take minoxidil for, and how recently have you stopped it?
Like, that was years ago, so I don't think like any like would still be here.
Well, like, but how long did you take it?
I'd say about like 3 months.
3 months. Okay, that wasn't really, most likely wasn't long enough to do anything. Okay, so your doctor told you minoxidil. You off that for 3 months. You did the crash diet, had a telogen effluvium. It didn't come back. What else have you done?
So I've just been like trying to do like all the natural remedies, like scalp massages, all that stuff, but that didn't work either. Right now, I was prescribed like I went in and asked about finasteride, but I've still been kind of holding off on it. I'm not sure like if this is androgenetic alopecia or not.
Okay, so what kind of doctor did you go to for your finasteride?
Oh, that was just a physician at the time, but I've also been
Okay,
to
just like a GP.
Yeah.
Okay, all right. What you need to do is you're in Toronto, and there are. I'm trying to think of IHRS doctors in the area. Dr. Rahal, and then I don't know if there's anyone else. But look, being 22, I know what it's like. Like I started losing my hair when I was 17. I was 22 when I had my first procedure. First of two really bad procedures. So the first thing I would encourage you to do is not consider surgery at this point. You've done very little in the way of prevention or restoration through non-surgical means. You've done very little. So your journey as far as prevention and actually be proactive is just beginning. And I would encourage you to take the next step of going to ihrs.org, which is it? Spencer?
Both. Like, I always say org.
Yeah, .org, ihrs.org. Find doctors close to you. Go see them. Arrange for consultation. When this thing lifts, until then, do an online consultation, of course.
Yeah, please do not go to anyone who has their office open to have a consultation. Cross them off your list.
If you do find one, if you do find clinics that are open,
let us know.
Let us know. Let us know. Contact us, or contact me. Contact IHRS. But here's the thing: you need to get solid information from a specialist. GPs are fine for general stuff. That's why they're called general physicians. But you want a specialist that deals with this day in and day out, that breathes hair and hair restoration. So, yeah, and you'll be classified. You'll get a classification: Norwood 2, Norwood 3, whatever, diffused. You'll know what your options are moving forward, and they most likely will recommend finasteride of some sort. I'm not a physician, but I do recommend that you highly consider the route that they suggest for you. There are also non-medical procedures like PRP, things like that, maybe even laser. Don't try any of these at the same time. Ultimately, though, and if it were me, like finasteride is the baseline standard that everything else is compared to. So I'd skip the line, just go straight for finasteride to start.
Okay, so that was my question. So do you feel like I should just start on finasteride? Because I've been debating to start it in.
That's up to you. That's up to you. I was just telling you what I would do based on everything that I know. It is the standard that which everything else is compared. How does this compare to finasteride? How does that compare to finasteride? That's where I'd start. Give it minimum 6 months to see how it does for you. But with what I've seen in my experience over almost 20 years, once you start it, you don't want to stop it, because at the very least, like unless you're having bad side effects or something, but if you start it, you're most likely going to get some sort of benefit, even if you don't see it. And if you stop taking it, then you might notice that, well, maybe it was doing something. So consider that. But it is a standard that everything else is measured by, for sure.
Should I wait till I get examined by a hair transplant specialist?
Of course. Of course. Well, you can't just start finasteride unless you already have a prescription that you filled. It is prescription only. You already have it. Okay. Okay. Well,
what's my so should
take it when you're comfortable.
All right, man.
Hello?
Yeah.
All right, man. Listen, I hope this call helped. Most of all, stay safe during this time. There's a lot of opportunity for you to reach out to physicians online right now to get a lot of your questions answered. And I would take advantage of that. There are more doctors now than ever before who are working on their telemedicine game and your ability to actually reach out to them. So take Joe's advice, go to iahrs.org and, contact as many guys as you need to, all right?
All right, thank you.
All right, good luck. Phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hello, my name is Ben. I'm calling from Toronto.
Ben from Toronto. How are you, man?
Hey, Ben.
Hey, yeah, the other John was also from Toronto. That's cool. What a coincidence.
So what's up?
So how you guys doing? Good. Called in earlier before this whole thing happened, and just recently had a hair transplant a month ago. So I'm recovering from that.
Who'd you go to? How many grafts?
I think I remember your call, and we told you not to get a hair transplant. But who'd you go to?
Yeah, I still decided on going. Just pulled the trigger, and I really feel like I'm pleased with the results so far. Although it's very, very early to tell. I went to Esther World, and I got to see Dr. Aiken Isik, who has 15 plus years of experience, over 65.
You're breaking up, dude. You're breaking up.
6,500 treatments. And
who'd you go to?
Very good doctor. She worked on the front hairline part.
Who did you go to?
And the rest of her team.
A clinic in Turkey called Esther World.
It's not a clinic. It's actually a hospital. Like a whole. It's a hair transplant hospital. So they're already a step above. And I was looking at all the.
Let me stop you. Let me stop you. Can you tell me the difference between a hair transplant clinic and a hair transplant hospital?
These guys, so the hair transplant hospital is way more experienced also. And it's just the whole vibe going in. It was super professional.
I know clinics that have been doing this for 35 years that are not hospitals.
I don't doubt that. The clinics, no doubt, are probably performing just as good as these hospitals. But it just going in, everything was clean. Then the COVID thing wasn't breaking out so much, although just my travels and going around there, I did feel a bit uneasy. But that was also what pushed me to do this hair transplant, was the fact that that I might not be able to get a hair transplant. I was researching the COVID and that this pandemic could go on for many months and a year, and I want to, and I know there's the ugly duckling phase and all this, that it's going to take 9 months to see a difference, or a year and a half to see the full outcome of this, and I'm going to need several hair transplants because I'm a Norwood 6, closing in the Norwood 7. My brother is Norwood 7 and 8 years older than me. I know from genetics where my brother
is. You see your future. Yeah.
I see his future
Painfully,
too.
I see it. I'm still going, 34 years old. I did this hair transplant, basically nothing on the front of my head, so the density sucks. I only get 3,500 grafts, and I did with A-cell and PRP. So the A-cell definitely helped, I feel, with the healing of the donor area, and but what I see a lot now for the past 2 weeks out there is a lot of folliculitis, a lot of pimples, and I've been prone to pimples. Like I have a lot of pimples on my face, and every time a pimple bursts, there's a few hairs that come out. So that's basically why I'm calling. I'm just worried about these pimples because I have 3 at a time.
What is your clinic? What has your clinic advised you?
So I did contact them, but they're closed. So it's hard to get a response out of that.
Really? That's interesting.
Really?
That's interesting. So you flew to Turkey to have a hair transplant, and now they are no longer available to help you.
Against our advice, by the way. Against our
I
advice, by
am
the way.
in contact with them, giving them updates. They said they send them pictures. So I also used your guide of taking good pictures.
Right, but there's no one available to help you with your post-operative care. That's what you're telling us.
Well, they will be soon. I am getting some messages. I actually have directly Akan on Instagram, so I've been talking to her, and she has been giving it advice, but she doesn't.
Now, what happens if you had an
translator.
infection and you needed antibiotics? What happens if you had an infection that can cause you to basically necrosis and potential death, heart attack,
don't face bump,
stroke?
Okay, I know. I take all these risks.
This is what it's been reduced to, people. Primary post-op surgical care conducted through Instagram. Thank you very much. Good night.
Look, we want you to do well. We want you to survive this and to be healthy and all that stuff. But we have to use you as an example of everything not to fucking do if you're considering having a hair transplant. And this is a prime example of what can happen. Were we aware that we were going to deal with a pandemic? Absolutely not. But we did state clearly that your post-op care, if something went wrong, even in the best circumstances, would most likely not be there.
Yeah, I'm using you guys for post-op care.
Yeah, but that's not what we're here for. I don't mind giving you advice. We're not doctors, but you went to see a physician. You went to a fucking hair hospital, and they can't get it together enough to have a doctor contact you? What the fuck are they doing now? Watching Netflix?
I know exactly what they're doing. They're going fishing.
Yeah.
It's the world.
Yeah.
Well,
dude,
I'm worried about the
there is no reason why they shouldn't be contacting you for follow-up. That's their job. And any responsible clinic or hospital has people, including the doctors, sitting at home, going through their patient lists and doing proactive follow-up to make sure everyone's doing fine, so that no one's feeling like they've been left alone like you were. This is not the way it should be done. So I don't want... I say this because, it's important for everyone else to understand this. It's important for clinics that are listening in and watching to hear this. It's also important for patients to hear this. I'm just like every once in a while I'm still surprised, and your post-op care is being taken care of through Instagram instant messaging. That blows me away. That blows me away. There should be someone sitting there waiting for your emails, waiting for your WhatsApp messages, because I know that everyone WhatsApp. So
I'm gonna try again. I'll talk to them, send them a few emails. So I'm not dismissing that they are not helping me entirely. I just haven't been sending the emails as regular as I should. So,
but here's the thing: we can't advise. We can't give you medical advice. We can't say, okay, this is the medication that you need to use in order to potentially defray or avoid any long-term adverse complications to your hair transplant. You know, so you're dealing with folliculitis. That's what you're calling it. But how do you know it's not more of an infectious issue? Is it painful?
Well, I pop it, exude it, and it's not too painful. It's just like a regular pimple on my face, and then I use polysporin after that to make sure it doesn't get infected again. So that's been doing a good job with healing, especially the polysporin that has special healing properties also. So that seems to be going well. It leaves a scar, not like the hair transplant scar, but just like, like it just the scabs come off. I'm not scar, I'm not scab. Scabs come off just like the hair transplant scabs came off. So
right. So when you said that you burst the pimples and then you see hair fragments coming out, does that pimple come back?
One pimple actually recurred, and that's because I think I didn't put the polysporin on. So I started putting the polysporin on. Now they stopped recurring. But I've been having these are less worst form of pimple is more like I forget what it's called. like just huge pimple. I know they have
like a cyst.
Cyst, yeah, or it's just I've always been prone to these, and I'm 34 and I still have them on my face too. But I use all kinds of skincare products to prevent these, like Roche-Posay and different other ones. But I've been starting to use Roche-Posay on my head also, if you can. And it does seem to help a little bit. I've started a whole regimen. I'm on Fin. I'm on. I have the laser cab, and I just ordered the derma roller. Doing
okay, stop.
Sure,
stop.
I just want to fucking hang myself. I'm so tired of this shit, man.
Why are you
tired?
No, listen. Why are you adding all these different regimens? Why are you ordering laser caps? Why are you ordering derma rollers? You do realize that if you're using a derma roller, it's piercing your skin. If you have these pimples flaring up, and you start using a derma roller, guess what you're doing? You're spreading that infection from one area to another.
Okay.
And you're going to have more pimples on top of your scalp. You can actually spread infection that way.
I just want to tell you, I just want to make it clear, I'm not sick of you. I'm not sick of this call. I'm just so tired of how fucking irresponsible so many people in this industry are.
No problem.
And that you are left alone to struggle with this information. Now, I wish you would have taken our advice initially, but you didn't. That's your choice. But I wish to God that these so-called physicians would take this as seriously as it is and understand that they're dealing with human lives. And you are left calling a fucking podcast to ask medical questions. It's insane.
But okay, just this specific one, because I'll be honest, I didn't ask them about this yet, about the pimple. I don't know if I don't think I said I did ask, but I've been asking other things. I just know that they're still closed, and I asked Akan about the derma rolling, and she said a month after the hair transplant, fine, and to use the spray, which they call Procapil, is what they want me to be on, which is funny, instead of minoxidil, because that's a herbal thing, and you can't even find it in Canada. It's just their own product, actually, that they sell. So, and they wanted me to buy it, and that's a problem. So I just gonna go on minoxidil. I found, because that's anyways the FDA not approved, but suggested one. And, I used to be on minoxidil, but I just realized now derma rolling with a combination with minoxidil.
All right, dude, I'm gonna have to cut you off. What can we do for you right now to give you some basic help in your current situation? Because we can't help you with your hair loss process and your treatment protocol, because we have given you the advice that we thought was most appropriate, and you chose and continue to choose to move in another direction. So what can we do to actually help you with this situation that you're dealing with right now?
So I've called basically with the objective just for having the pimple issue for now. I am a follower of your show. I've called in eventually again if I have any help. Like the other chatter says, like, hang up. Well, I got an answer for the pimple thing, but I'll want to keep monitoring it and see if how the issue, if it's persisting, because I heard that even after 6 months, between now and 6 months, folliculitis is supposed to recur, so in some patients. So we'll see. But I've been using scalp massaging. I've been taking all the vitamins, and now just doing so much more research.
Here comes a cliche. If I had a nickel for every time I've had someone say I had a hair transplant and now I'm doing a lot of research, I would not be sitting here in front of this.
See the eye rolling.
Yeah, I am, because I've God, everything you just, dude.
Hey, I'm actually.
I wish it.
I'm sorry that you're acting this way, honestly, because I feel like I'm doing more research than a lot of other people, like on these Facebook groups and forums, and I'm reading a lot of forums. Like I'm spending good.
Look, we don't want to. Listen. Here's our reality. We want you, anyone who calls this program, to be okay. That's the truth. But we also have to kind of allow our listeners and our viewers to understand how we're feeling about a call like this, and why your issues shouldn't have ever even gotten to this point. If someone calls us, we give our very best advice. If I remember your call correctly the last time, and I do, you were a head shaver who looked good with a shaved head.
Yep.
And you were about to pull the trigger on a decision.
You're right.
You already booked a flight to Turkey, and then you were like, well, if I don't get a transplant, should I get PRP, all this stuff? At the time, you did everything wrong. Now you're doing some research. Great. That's absolutely terrific. But we can't help change what you've already done. But I think it's important that consumers who are watching this program and potential patients know that every step that you made, even though you may be doing more research than others now, you went against really common sense advice. You decided to jump in feet first, and the consequences of that, let's hope, are not adversely life-altering.
Yeah, I hope so.
I'm say that you decided to jump in feet first, and completely ignored everything that Spencer and I told you. You jumped in feet first, and then you started to look up how to swim.
This is a time constraint, though.
I mean, there are people in the chat that actually think you're trolling us, and I would say no. I would say
the progress on the forums.
Listen, I would honestly say that based on our conversations, I could tell you're not a troll, but I understand where they're coming from, because
absolutely
the line of questioning and your reaction is just interesting.
But I just want to emphasize what Spencer was saying. That the way that we're reacting to your situation and your questions and the comments that we're making, it's imperative for other people to hear this, because I'm going to be blunt about this. We've given you advice. You say that you've been watching the videos and the broadcasts, but I can't say that any of it's gotten through to you. And it's unfortunate. However,
that's unfortunate to think that, though, because it is going through to me. I'm taking it all into consideration, and I really appreciate it. And that's look. I understand your point, and I appreciate that. But you got to understand that what I'm hearing you say to me is contradicting that.
I have some basic questions. Do you have the cell phone number of the physician who performed your surgery?
I only have the translator.
Okay.
So
you went to a physician who you couldn't even communicate with.
I do have an Instagram of the doctor, but that's my only contact. I have the translator because anyways the doctor doesn't know English very well. Turkey.
There you go. Here's red flag numero uno.
That's the only way nowadays to get a reasonably priced hair transplant.
That is where everything in this industry and the ISHRS and all these grand poobahs in this fucking field have failed all of you. They have failed you. This industry has failed you. And that's why I get so angry. And the people who are contacting me, even through my organization, who are, so fucking worried that there's no leads coming in from other resources, for God's sake, man, these are human beings for the doctors who are listening that you were dealing with. Listen to this poor guy. He had to go to another fucking country to get a reasonably priced hair transplant. Let me tell you something, man. Back in the day, when it came to any form of cosmetic surgery, it was elective surgery, unless you could afford the surgery or find a way to finance it, you didn't have it.
Mm-hmm.
You didn't have it. You didn't decide to buy a fucking, scooter as opposed to a Rolls Royce just because you wanted some transportation. Does that make sense, Joe? Probably not. But you know what I'm trying to say. You know what I'm trying to say. You're not going, no matter what you think you guys are getting, Even even through cosmetic surgery tourism, corners had to be cut to provide you with the hair transplant that you just had. And part of those corners that are being cut, you have no follow-up care. These people should be on the phone with you every day. You should have access through Skype, FaceTime, WhatsApp, anything, video chat.
Okay. Oh, one other thing, actually. There's one other thing I have a question about. When they did the transplant, it looks very... okay, it's in rows. So it looks a little artificial in that.
Oh my God! It's just that. Are you trolling us? You have to be trolling us.
No, I'm not. No, it shows in the pictures on the forum because I didn't have much density. They did a little bit, maybe a robotic way that they did it. I'm wondering if there's possible to repair to put hairs in between the rows so it doesn't.
You just had a hair transplant that we told you not to have, and now you're talking about repair surgery.
Now you're trying to figure out how to fix it.
Okay, maybe this
2 months out.
Dude, tell me, come on, dude. If we're punked, just let us know, please. I just want to know. Are we being punked right now?
No, I posted a picture on Bald Truth Forum, so of the outcome to see it, and you can see it, but nobody commented though about. Okay,
I'm going to stop. I'm going to stop right there. Okay, so at this point, how long ago was your surgery? A month ago? Two months ago?
Exactly 31 days.
Okay, so a month ago you had your surgery.
Yeah.
You can't tell shit right now. I don't care where you went.
80%.
Yeah. People tell you. Doesn't matter. Don't start looking how to fix something that hasn't even manifested yet. Full stop. Okay?
Yeah, I'm just.
You'll drive yourself nuts. There's no research to do because you don't know what to research for.
And I'm going to be completely honest. If you are 4 months out and already thinking about repair surgery, you're probably shouldn't have had a hair transplant. That's all
4
I'm
months.
saying.
He's 1 month.
1 month. So this isn't that I told you so. My hope for you is that it all works out. But
absolutely.
But for everyone who is listening,
I hope so too.
For everyone that's listening,
I really want my hair.
This guy is a prime example of what not to do ever in anything in life, but especially when you're considering cosmetic surgery.
Okay.
And don't take that personal.
Don't take that personal.
We appreciate you.
We're here for you, and that's it. We'll give you the best advice possible. If you do need repair work someday, we'll help to guide you in a safe direction. It probably will not be inexpensive, and it will probably cost you, in the end, 3 times the money that you spent just now to feel comfortable in your own skin if you need that repair surgery. You may not need it. You may be just fine.
Yeah. I wanted to maybe ask someone, but all the places are closed. I was checking on YouTube. The Hairlicious guy wants to go next week to check his donor area to see how many grafts he can do. And he's going in because I asked him on the comments. And
where the hell
he is actually still going in. And that's a good question. We should ask where the hell he's going. In the U.S.
Well, he's not going. Well, I can imagine he's going back to Korea, which is where he had his first and second surgery.
Yeah, the Korea. But I don't think he's going to get on a plane now to go to Korea. It's probably someplace else, close to home, locally. Which is something I want to do maybe with, you said that in Toronto, the guy, Rahal, I don't know if he's open. Maybe hit up Rahal.
Well, listen, man, we are going to take some more phone calls, but just
don't tell
stay
him we
home.
sent you.
Just stay home and have as many consults as you can online. They are free for most doctors, and let them assess what's going on with your head. All right, man. I wish you the best. Hang in there. I wish you the best of luck.
I love you guys.
All right.
I love you. Bye.
All right. We love you
too. Good luck,
too,
buddy. All right.
I mean, we love you. You're great radio. What are you going to say?
Don't tell Dr. Rahal we sent you.
Holy mother of God. Jesus. And this is why Zach probably shouldn't have had a hair transplant.
This is the way I feel. I just got out of a car wreck. God bless him. God, he's a good guy. He's just.
No, he is a
led
good
astray.
guy, and I don't want him to feel like we are picking on him. But I think that it's an
we
an
weren't
opportunity.
because he didn't go to a clinic. He went to a hospital.
Right. But it's an opportunity for others who are tuning into the broadcast to understand what's really going on out there. Sadly, he is not the atypical patient. The guys that have found us who have really watched The Bald Truth and have been a part of what we do for a long period of time, they normally are, they're in the, they're the anomalies in this field. The average hair transplant patient is now finding their bullshit through Instagram, Facebook, and YouTube.
Yeah. And apparently getting post-op surgical care through Instagram as well.
But I do say, like maybe this is the time I just hang it up during this pandemic. I swear to God, when I'm listening to these doctors panicking and I'm listening to the patients who can't get hold of these fucking doctors, I'm like, I have to somehow live a life. You know what I mean, Joe?
Well, if there were some enterprising doctors out there, they'd set up a new business just for post-operative support right now.
Yeah,
because they make a killing apparently.
Yeah, but if they don't have a good YouTube presence or Instagram presence, and they don't have a fucking translator, they're finished. 888-659-3727. Jesus. Hey, you're on the air. Who's this and where are you calling from? Hey, man, what's up?
Oh, hello.
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 Oh, hello.
Yes, hi, you're on the air.
Okay, great. My question's not anything like the last callers.
Thank God.
Anyway. Yeah, thank God for that.
God bless you.
So, for instance, my situation's slightly different to most of your callers, I imagine. I don't currently have any hair loss. It's just I was born with slightly high hairline and it was uneven. I did get a hair transplant earlier last year with, I don't know if you've heard of the surgeon, it's Dr. Lars Heitmann from Zurich, Switzerland.
Yeah,
sure.
Uh-huh.
And I had 1,700 grafts. It took the angle off. It looks much better now. It's only been around 9 months, but it's grown through quite well. But the only issue I'm having now is I've got another date with him in December this year, whatever happens with this virus and whatnot. But it seems a bit strange, but have you ever heard any good results from forehead reduction surgery along with hair transplantation? Or
stop. Yeah,
I know.
Stop,
Stop.
Yeah. Don't go there. Don't go there.
Okay.
Forehead, I understand, and it's a really drastic procedure. I highly recommend against it unless you are one of those patients that have had a really fucked up hair transplant. Super low on your. I've that's the only situation where I would say that that's a good idea. It can work great, but it's not. It's too extreme. Too extreme. If you have no native hair loss, and you went to get a hair transplant, enjoy it. Enjoy it. Maybe some density in a second pass if you need it, because that's actually typically for people that have, in some cases, what's called triangular alopecia, where you have naturally high temples but no hair loss, or just a high hairline like you're dealing with. I remember very specifically a kid from Switzerland, of all places, coincidentally.
Okay.
This is about 15, 16 years ago. He also did not have any sort of hair loss.
Right.
But he went to a clinic and they lowered his hairline. And unlike your situation, you went to Dr. Heitmann, and he's a good doctor. They literally put his grafts in upside down. And he developed a condition. It looked like an allergic reaction, because he had so many and hairballs that had grown on his forehead. He looked like an alien. And those grafts had to be cut out, like a forehead reduction surgery, or brow lift, as it can also be referred to, was performed. Right. And then the strip of tissue was dissected, and there were these massive hairballs that had grown under the skin. Now, will this happen to you? No, of course not. I mean, it was a major, major screw up. But it's just a reminder that you don't need to do this stuff to yourself. Like, in most cases, a naturally high hairline with no hair loss, most clinics would turn you away to begin with. Now, sight unseen, don't know what your case was like. But most clinics would say, hey, look, you got a full head of hair. It looks great. Don't bother with it. There are cases where it does make sense. Sure, if you want to lower it, go for it. I'm sure that going to Dr. Heitman, he told you about the dangers, about the potential downsides, side effects, all the good stuff. But count your blessings.
Yeah, of course.
You got away with a good result. Don't go extreme.
Because I only had 1,700 done with Heitman, because as you probably know, he does everything by himself, so he can only do everything.
Mm-hmm.
He can only do about 750, pushing maybe 800, 900 a day, because he doesn't have an assistant. However, and he was saying that I could go back there another 2 times. He'd be happy with that. I've seen Dr. Bazanga. He was happy if I wanted to go with him. So you're saying that, how do I put this, that there's no benefit in doing full head reduction surgery and then doing an FUE to cover the scar because, as you were saying, it's a pretty drastic procedure.
Well, what are you going to do with the grafts that you've already had placed?
This is the issue, isn't it? Because I would imagine...
Like, it's a waste. It's a waste of 17...
Yeah, of course, yeah.
You're wasting 1,700 grafts. And then if you don't have hair loss, where are those going to be placed? Because they're going to be taken out in the strip. So where are those grafts going to go? In the garbage?
Yeah, of course. And I imagine, because obviously the density is obviously going to be less where the recipient sites are, even if there is going to be a scar, even if it's a very small scar, it's going to be much more noticeable than it would be if it was a sort of if it wasn't going into transplanted area, if you see what I mean.
I'm sorry, repeat that?
Yeah. So how do I say this? As I have, obviously my front hairline now is from an FUE procedure, and it looks dense enough, obviously with Dr. Lars Heitman. However, if I did have that forehead reduction surgery, they obviously need to make a scar. They need to make an incision in where this new hair has been implemented, if you see what I mean.
Of course. Yes,
So
of course. They're going to shave. They'll shave down your forehead, and then they'll take a scalpel and they'll run it across from one temple to the other.
Yeah, of course.
And then another incision below that, and they're going to remove a strip of your forehead, as if it was an FUT surgery, but from the back. And then they're going to close it up with stitches or staples, probably stitches in most cases. And you're going to have those stitches in for about 2 weeks. And your forehead will be exposed, a pinkish, reddish line for 3 months.
Okay.
If it's done right. If it's done right, it'll be red for 3 months at least, also depending on your physiology. Are you a pasty white guy? Are you very fair skinned?
I didn't scar terrible with Heitman, but
that wasn't the question.
I think I'm a bit
wasn't
more...
the question. No.
Okay.
Are you fair skinned?
Yes, yes I am.
Okay, so you're prone to more redness than someone that's not so fair skinned. Is that fair to say?
Yeah, I would agree. Yeah, I would agree with that.
So it could be longer. You could have this red inflamed line across your forehead that you can't explain away to anyone. So unless you're in a position where you can wear a hat all the time, not a good idea. Not a good idea. And that's just the recovery.
But thank you very much for explaining this to me, because I did speak to... I've looked a little bit. There's a guy in America called Dr. Epstein. I think he's I don't think he's out of Miami or somewhere like that. And I think there's a few
Jeffrey
others.
Epstein.
That's the one. I mean, his stuff looks okay, but I did have a discussion with Bazanga about this in London initially, and he was completely against it, but he didn't really tell me too much about it. He just said, no. I don't know if you know Dr. Bazanga from Belgium.
Yeah, he's a good guy. He's ethical.
Yeah.
And he said the right thing to you.
But when I look at some of these online results, I think to myself, okay, I could probably have about 3,000 more grafts done, 2.5 realistically, because I don't have any. I've got quite dense hair. I've got no hair loss, nothing like that. So I was looking at it from the point of view.
How old are you?
I'm 27. So
I'm sorry.
27.
27.
Yes, correct.
Okay, I'm going to just interject now and say you don't know what the future holds for yourself. And just like just like 3 callers ago, he said there's no history of hair loss in his family. He was 22.
Okay.
And he's losing his hair. And I know many men. Actually, one that stands out is a guy that I met when he was about 41, and he also was full head of hair for all of his teens, 20s, and 30s, and then in his early 40s, his crown started to open up, and when you watch the replay on YouTube, you'll see I'm holding my hands up in a circle. His crown opened up like quite big, actually. And he needed 3,000 grafts just to fill the crown. And of course, everyone knows, if you need 3,000 grafts to fill up the crown, it's never going to have the appearance of density and fullness that it had before hair loss. So I would caution you with the idea and the false security or potential false security that you have with your hair now. Stop chasing your ideal hairline.
Okay,
Period.
noted. Thank you very much for your advice. And great.
welcome.
Thank you for this. All right.
Well, listen, good luck, man. Hang in there.
Yeah.
Okay.
No problem. Thank you.
Bye-bye.
Keep up with the. Bye.
Thank you.
Thanks.
Where the fuck are my pills? That's all I want. That's all I want to know.
I gotta tell you, we got some interesting callers today.
100%. I mean, I'm going to call it a day.
Got anyone else?
There's no one hanging on right now. I mean, if someone calls in the next minute, I'll take it. But otherwise, I think it's just time to call it a day. I got shit to do. We had a very busy show today. I want to thank everyone who took the time to call in. And, you know, these are, you know, let's put it this way, historic times. I want all of you to know who are considering hair transplant surgery or have had hair transplant surgery that this industry will never be the same. And my hope is that prospective patients understand that this industry has been commoditized to a degree that we have that poor guy that called in, I forget his name, who his only concern was a reasonably priced hair transplant. And my hope is that he comes out of this okay. But the reality is that he's a Norwood 6 already at a young age, 34, was a head shaver.
And he's unemployed. I just remembered that.
And he's unemployed.
Unemployed.
Lived his life.
Wow.
Said he looked good because he trained and he had a good body. But wanted something that he just didn't have. And that was hair. It wasn't like his life was destroyed by not having hair. It wasn't like he couldn't leave the house or live a life. Or he even admitted that he looked good as a head shaver.
With a shaved head. Yeah, I remember that. It's all coming back.
This guy had already won the battle of hair loss. Now it's possible, just given even how he's explained and expressed what's going on with him now, that he has stepped into a new battle that he never, ever could have imagined himself going through.
Yeah.
Now, I hope that's not the case. I hope these grafts grow. He has no more folliculitis. He doesn't have any other form of infection. Maybe he's a candidate for more surgery because he's going to need it. He will not be happy with one procedure.
I hope he can call back and tell us that we were wrong. That's what I want him to be able to do.
I hope he's like, fuck you guys, man. Check me out. Look at my hair.
Fuck you.
Yeah.
Exactly.
Right, we do have another call, so we'll take it, and then that's going to be it.
Okay. But we're off at 4.
Okay. Joe just... Hey, man, you're on the air. Joe just made that clear. We are done at 4. Go ahead.
We'll cut you off mid-sentence.
Okay, yeah. Hey, Spencer, it's Jeff from Connecticut. How's it going?
Hey, Jeff from Connecticut, man. How are you?
Hey, what's up, Jeff?
The Constitution State.
I'm good. Hey, Joe, how's it going? Yeah, no, I'll make it real quick. It's just piggybacking off of the guy that the one that everyone thought was a troll. He just said something that kind of like made that kind of like rang true for me, or just made me think about something kind of like early in my journey. When he said, you know, he has like, oh, he has these pimples, and now he's ordering the laser cap, and maybe I should derm roll to make things better. When I go through with telogen effluvium sometimes, and like early in my journey, like I had some pimples come up, and like I would try to throw like everything at, because it just makes kind of like the patient feel better that they're doing something.
No question.
Yeah, in my experience, having gone, like, I had my first transplant 5 years ago. In my experience, just doing nothing and just letting time kind of play itself out is sometimes the best, you know, thing. I went through, I had some pimples and some rashes, and like the worst thing I ever did, actually, the stupidest thing I ever did, I had some redness, and I thought it was, you know, I could kind of reduce the inflammation by putting some vinegar on, and I used some undiluted apple cider vinegar, and I put myself through a shed that took like 6 months. So it's just like these random that took 6 months to recover from. So, and it put me into an effluvium. So just like all these people listening out there, if you're going through, like, if you're noticing like something that doesn't look right, just give it some time. Don't throw derma rollers and lasers and everything at it. It's basically, you're just playing with fire. And it's just like, if you're on a good regimen, just don't start stabbing your head and putting acid on your head and all this shit. Just let it play out, especially if you're fresh out of a transplant.
I have to say that was
an
incredibly lucid and just brilliant argument against everything that this guy was putting out there. I mean, that is a commentary that everyone, I'm going to put that on a loop, should listen to over and over and over again.
It'd be my ringtone.
I mean, that's been
my message.
Essentially been our mantra forever, and you've experienced it.
Yeah, because when I was younger, I mean, I talked to Joe a bunch, and I would ask him kind of like these same questions. I'm like, oh, do you think derma rolling would help? Oh, do you think lasering would help? What if I got like 10,000 micrograms of biotin? Would that help? No, just give it some time.
Yeah,
just like it's like none of it helps. Especially, like, you're not going to speed up your transplant. Like, maybe PRP would help with that. That's debatable at best. But just give it some time. If you're going through a shed, like the last thing I went through a shed, and then I put Rogaine on, and then I got all flaky, and then, you know, it took the shed, it took longer for the shed to come back. Just give it some time, and don't fuck around with a freshly, you know, planted transplant or whatever. You know, just give it some time.
Yeah.
Well, listen, man, Jeff, that's incredible advice, and I'm glad that it's coming from a patient who's experienced what it's like to throw the kitchen sink at their situation and then have to deal with the ramifications of that. It's literally the worst
thing you can do, and then you're just like, then you shed more, and you're like, oh, maybe I should throw it out. You waste money, and just don't do it. Just stick with finasteride, and just chill out.
Well, Jeff, listen, man, before we let you go, how are you doing otherwise through all this?
I'm doing okay. But my Dr. Cooley was my repair surgeon back in 2017, and we've been giving it, you know, ample time. And I was actually going to get a repair procedure early in March, and then with the whole virus stuff, we kind of just postponed it, and we're going to wait. And he did a great job, by the way. He just there's a little bit of it. There's a small area on the right side that still needs to be adjusted, that looks a little bit pluggy, and nothing like extreme. We were talking about like 300 grafts just to like camouflage some of the plugginess. But overall, I'm doing good.
Oh, good. I'm glad that you're doing well. You know, the bottom line for all of us is, you know, we need to get through this. Life is going to be much different. We're going to have to adjust to things that I don't think, honestly, the press and at least our government is not providing, I think, what all the information that citizens need, and a full understanding of what life is going to be like, you know, during COVID-19. You know, this is a new normal. That's it. Nothing will be the same. Things can be better in some cases. But, you know, we're going to be providing information about, you know, and it's going to be vital information about people who are traveling abroad, if they should travel abroad or not for surgery, if they're traveling in the United States, what needs to be done, every facility that is providing hair transplant surgery is going to have some really important protocols that are going to have to be put in place. And if they're not, it is going to be my suggestion that consumers stay away.
Yeah, sure.
So, my hope is that there are more people like you, Jeff, and less people like our last caller who are considering surgery. And again, I don't want to beat up the last caller, 2 callers ago, whatever. I don't want to beat him up. But that is an example of how not to handle this situation.
I mean, it's just really age and inexperience. I got my first hair transplant when I was 23, 24, and I was way too fucking young to do it. And I probably would have been like that, like the 30-year-old Norwood Sixer, or I don't know how old he was, but the idea of just you really need this so badly, and the virus is coming, and I need to do this before the virus destroys all the hair transplant clinics and stuff like that. You just kind of think of like the worst possible outcome, and I was so desperate to get it too, and I was only at Norwood too, and I think a little bit about my journey. I just didn't need it at all.
Well, what's funny, Jeff? You said before the virus destroys all the hair transplant clinics. He went to a clinic that probably will never reopen. He went to a clinic that probably will not survive.
That's true.
The Turkish market, as it stands, unless they are a select group, and there's a very small handful that will survive, cosmetic surgery tourism is over for a minimum of 24 months.
Just in case anyone is wondering, we're talking about Esterworld Clinic in Turkey.
It's a hospital show. It's a hospital show.
Oh, sorry, you're right. It's a hospital, Esterworld Hospital.
Look, whatever it is, and to me, this isn't about pointing out, specific places in Turkey, because most of them suck. That's just reality. There's a handful.
One at a time.
There's a handful of really good clinics in Turkey, and I feel bad for them because they are fighting this black market more than anybody else in the world. They have to compete in their own country against these fucking mills. And that's unfortunate. Well, listen, Jeff, good luck to you. I'm glad that you were able to tune in. Hopefully we can do the show again live next week. It's really up to Joe because he's been putting the kibosh on every show.
It's all me.
Yeah, for sure.
All right, man. You take care.
Good hearing you. Good hearing from you, Spencer. Both of you guys stay safe out there.
We're going to do our best, man.
All
right. Take care. Bye-bye.
All right, thanks.
All right. Closing up shop for the day. It was a fantastic broadcast. I have to tell you, this is my most enjoyable part of my fucking work. I realize how much I miss it when I have to deal with the day-to-day bullshit that you guys don't know about. And now, with the entire industry in a panic, I'm essentially talking people off of ledges. I have become the hair transplant therapist for the industry, the whisperer. Like, why is it my responsibility? I don't even understand this. I don't mind doing it to help the physicians out and clinics and their staff members, but how do they not have a reasonable game plan in place to help their own staff through this?
I want to know why I'm getting text messages at 2 a.m. from doctors that I don't really talk to.
Yeah, well, I told you that's been happening to both of us. I just got something forwarded to me from a doctor who's in another country, talking about how their doors are closed and they don't know what to do, and well, I'll explain some of the stuff off the air, but I'm just like, you're fucking doctors. You didn't prepare to close your doors for a month or two? You travel to fucking Bangkok for a meeting and have to shut your doors for 3 weeks. How is that not a problem? What's the difference?
Yeah.
Except now, it's a little scarier, and you may not have prepared for it. You have no choice. But when you go to places like Bangkok for a fucking international conference and you have to pay your staff and travel there and shut your doors and not do surgeries or any types of procedures, not even consultations, that's factored into your year. Factor this in as a couple of vacations and you guys will fucking be fine. All I'm going to have to say is, People are just idiots.
And that's the truth.
And that's
the bald truth.
That is the bald truth. Guys, I'm not going to give out too many websites. You know our websites. You know Joe's website, hairtransplantmentor.com. You know Joe's YouTube page, which is youtube.com/hairtransplantmentor. Subscribe. Click the like buttons with everything that you're watching.
27 likes. Today, this is a record-breaking show for us. We had consistently in the high 80 and low 90 range of concurrent viewers at the very same time. And that changes. It's actually hundreds of people watching.
Yeah.
And we have 29 likes. What the hell's wrong with that?
Yeah. Like the fucking
what's
show, people. Like it. Like it.
Patrick Tortorelli. Joe, why the shaved head? Hey, baby, it's the COVID cut. No haircuts anywhere. So I took it all off.
Yeah. I'm sure that the online folks will be like, Joe Tillman's hair transplant failed. Forced to shave head.
After it grew out.
Yeah. Oh, my God. What a fucking world. Can I survive another 5 years of this emotionally?
I don't know. It's starting to wear on me.
Gone fishing, motherfuckers.
Gone fishing.
We're just going to we're going to put the show on live. It's just going to be me and Joe in our respective boats fishing.
Bill Bass. It's a fishing show in the South, by the way.
Yeah, I figured. I know that you used to you use chatterbait, right?
Huh?
That's an inside. That's an inside. Web girl cam joke. If you check out web hookers, then you know what chatterbait was.
I can honestly say I have no experience with that, Spencer.
But I will tell you this: everyone who's listening is going to go on there right now.
Of course.
So, gotta love the web hookers. All right, guys. TheBaldTruth.com, IHRS.org for the International Alliance of Hair Restoration Surgeons. The American Hair Loss Association is AmericanHairLoss.org. As things progress, we will let you know this industry will be changed dramatically. Everything you thought and you believed about this field is now over. And soon you guys will be made privy to that. Through the IHRS and the American Hair Loss Association, we are going to be providing much more information and contact information for both physicians and for consumers to get some inside information about what's happening in clinics. I would not step foot in a fucking clinic unless you knew that place was safe. And we will be providing that information, not just through our resources, but to local medical communities, government agencies locally and nationally, and I'm working on something internationally to ensure your safety. This industry is going to open back up. You guys are all going to be able to get your hair transplants and your PRP and all that stuff, but you want to ensure that you're safe. And I would not trust anyone who's just hanging up a shingle, posting on their Instagram that everything's cool. Don't fucking trust it. That's my advice. Take it for what it's worth. I know our friend in Toronto is probably not listening.
Maybe not.
All right, Joe. Anything you want to say before we close shop?
No. Well, I do want to say we didn't really talk about Zach very much, so maybe next show people will ask questions about him.
I think that
really fast.
Yeah, I think that's a good idea. Maybe what we'll do is we're focused. Maybe we can just do another show just on Zach because I think it's important.
Yep.
Maybe you can get Zach on. Maybe you can get Zach's doctors on.
I was going to say, yeah, he chimed in on the last video in the comments section. Big long post. I was actually hoping to reference it in this new video, but I think he's taken it down. I couldn't find it.
You didn't screenshot that shit?
I may have, but dude, I'm always there's so many screenshots I got. It's like, what the hell do I do with it? I don't know.
I do want to make one thing clear. I can't blame a physician. Is my audio okay, or is it my headset that's fucking up? Probably my headset.
Your headset.
I can't necessarily blame physicians, especially those who are coming from the world of plastic surgery or cosmetic surgery, who aren't necessarily trained and taught what the reality of hair transplant surgery is. Because when they're sold devices, they are taught a certain aspects of that device, how to run the machine, all the basics. It takes a long time for people to truly understand what's happening in their clinics. I was speaking to a doctor the other day who said that it could take up to 2 years before a surgeon can actually adjust and readjust what's been happening in his own clinic, because you don't see results for a year. And then you're like, oh, wait a second, I should have done something differently.
Yeah.
It's really, in my view, it's important for the consumer to fully grasp what's happening. And unless a physician has enough time on tissue, if they are selling something in a gimmicky way, if it's not straightforward medicine, because this is what this is, then you need to, at the very least, have the right questions to ask, and they need to be able to answer those questions in a reasonable way. That's all I got to say. Until next time, guys, be strong, God bless, and thank you so much for listening.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.